Okay.
Okay, well, hi everyone. This is Majdi Hamarshi, chairman of the board of PAMA, and I am meeting today with Zahid Rahman. Is that how I call you, Zahid?
So my
Muhammad
legal
Zahid
name,
Rahman.
well, my legal name is Muhammad Rahman. My nickname is Zahid.
We'll go with
So
Zahid. How about that?
yeah,
We'll go with
all
Zahid.
my friends, family, and you guys are my new family. So yes, Zahid is perfect.
Very good. Well, for those who are watching us, so Zahid joined PAMA medical mission that went to Gaza between March 4th and March 18th. Is that right, Zahid? That was the third medical mission of PAMA to Gaza. We went in January, February, and the third one was in March. And it was a joint effort between different charities, including SAMS and JAPA and PAMA. And Zahid was one of our ICU nurses, and I will let Zahid introduce himself to you. Go ahead, Zahid.
So my name is Zahid. I'm an ICU nurse. I've been an ICU nurse for 15 years, and I've always wanted to contribute to humanity in one way, shape, or another. And then, unfortunately, the events that followed October 7th created a environment, situation in the Middle East that I was very, very passionate about. And I started searching for immediately. I started searching for any opportunity to be able to be boots on the ground and go help anything from, a in-hospital situation to rescue efforts. Because aside from nursing, I also have previous EMS experience. Long story short, I was initially I was rejected. I was turned down
I'm
by.
sorry.
No. Listen, honestly, it probably was because I wasn't ready, either emotionally or physically or whatever have you. Maybe I had to take care of my family responsibilities before I was able to go. Alhamdulillah, everything happens with only the permission of God. You know what I mean? So I got rejected, and it wasn't just you, because I applied to other organizations that I know that were down there. I got rejected by everyone. And then I started calling Zaina, and I started calling her up, emailing her. I think I was annoying her, and she finally said, "Let's just give this guy a chance." And alhamdulillah, the doors opened up for me, and I was able to take advantage and go down to Gaza, to Rafah, with PAMA. I was honored.
Very good. Well, how did you first hear about us, like the PAMA medical missions? Did that come in an email and an announcement?
So this was going back early in late October, early November. I swear to you when I tell you this, I typed in Google, I said, medical missions going to Gaza, Palestinian humanitarian projects. I mean, I Googled so many things, and PAMA happened to be like the top 2, top 3 of my searches. And that's when I started applying.
Very good. Are you part of SCCM by any chance? Society of Critical Care Medicine?
No. I'm a critical care nurse.
Yeah, I know, but critical care nurses also, they are part of the SCCM. The SCCM they have nurses, physicians, RT, nurse practitioners as members.
You're talking about the official organization, the national organization?
Yeah, SCCM.
No.
Yeah, you are
I'm not
not.
sure.
You're not. Yeah. I mean, I go there every year with our nurses, ICU nurses. We go to the conference, and they are. You can be a member. It doesn't have to be as long as you're an ICU member, a team member. You can be. So because we sent a call for volunteers through the Society of Critical Care Medicine, and many of those who are joining us, they are joining us through SCCM too. So that is.
No, no.
Okay, I got it. You did the search yourself. I see.
Yes, because I wasn't a member, so I never got any of those emails.
Yeah.
No, I did the legwork. I had to Google and fill out the form and contact, and the form didn't work, and it was just so much.
So what did you do in the mission? Like, where did you work? Which hospital? Which ICU? How long? So tell us what you've done there.
Like you said earlier, we were down there for 2 weeks, roughly, and we were at European Gaza Hospital in Rafah, and the campus is the hospital's like I think a 250 bed hospital. Um, it's a large campus. There's a nursing school there. There's dormitories there, and with the circumstances right now in place, um, it is also a home now for thousands of displaced individuals who are living in hallways, who are living in staircases, who are living in any empty space, any square foot that they could find. They have basically made it their home. Going back to what you were saying, I worked there. They have three different ICUs. They have the neuro ICU. They have the cardiac ICU, and then they have they have cardiac ICU, they have the endoscopic ICU, and then they have the regular ICU.
I see. Okay.
So we would round almost every morning with the physicians, and to see where we are. When I say the physicians, mostly critical care, and surgery or vascular, because almost 100% of these patients now are victims of the war. So they have any type of injury, from like a trauma where they have an amputation to their leg, a vascular surgery, a neuro injury because of blast injury, explosive injury, GI injuries, so many types of injuries. So we would round with the different kinds of physicians every morning, and we would do what we can. Now, only because we were there only for 2 weeks, so we can't really in a grand scheme of things. I was under the impression that we would go there and be able to take on an assignment and give some of these nurses a break, but in reality, that wasn't a possibility. And because we're there for 2 weeks, we would basically disrupt the flow. So what we were is that we were a resource for them for anything that they needed. I mean, I predominantly helped with wound care, and I helped with education. Because of my experience and stuff, simple things like, hey, let's get the head of the bed up a little higher. Let's not have this Foley pulling so hard. Or let's cover this central line dressing with let's just change the dressing, cover it a little bit better, reduce your chances of infection, and suctioning. But again, it has to do with the fact that they don't have adequate resources. It's very unfortunate. They have the skill set. They are without a doubt burnt out because they've been working.
So what's that like here in the US? We are used to a nurse a patient ratio 1:2. For people who didn't know, like each nurse will take care of two patients and will take care of the ICU catheters and lines and dressing, and the nurse will have the time. So there, what is the ratio?
There's no time. There's no time.
Okay.
Ratio. I've seen as high as 1:4.
Wow.
And there just isn't time, and there's no resources. That's the problem.
Yeah.
The biggest is the resources, and not to mention all these nurses, because they've been working so long, they're burned out. They're getting tired, and rightfully so. Imagine if we had COVID and COVID lasted for 6 months continuously. I mean, it lasted much longer, but we had the resources, we had the manpower, as well as the materials, the medication, the PPE. They don't have any of that.
Right. I know, and people don't imagine they are creative, they didn't have the tegaderm we have, they didn't have the dressings we have, and they have you were giving them a hand to do those ICU patient care tasks that they are overwhelmed and they don't have to do, and they are necessary to prevent infections, and can cause patients' life sometimes they're not taken care of. I see.
Absolutely.
So tell me about the ICU nurses, like compared to the US ICU nurses, like the different in experience and exposure, and how would you describe them?
Oh my God. So here in the States, including myself, I would describe myself as an adult ICU nurse. But with my experience, I can do just about anything, but only in the adult category, the adult realm. Over there, you would have a 5-year-old child intubated, status post, blast injury, right next to a 50-year-old male who's also a victim of an explosive injury with a leg amputation in the ICU, and he's also intubated. That one nurse has to know how to take care of both of them. Their experience is uncomparable to the experience that I have. I will tell you that much right now because I've never worked with kids in an inpatient setting. But yeah, they're very educated. They're very educated. They know that there are things that need to get done, but they're limited to time. They're limited to resources. They're limited to medication, and they say, what can we do? We do the best we can with what we have.
So what advice would you give to an ICU nurse who, let's say, will be going on next mission? Like we have a medical mission now, which is going to go from March 25th to April 13, I believe, April 8th to April 8th. And then there will be another mission going April 29th. So if there is an ICU nurse on the April 29th medical mission, what piece of advice would you give that ICU nurse walking into the hospital, joining the ICU teams and trying to help?
The only thing that I mean, there's a lot I could say, but right off the top of my head, be very patient. Understand that they are tired, understand that they are overworked, understand that they have no resources, understand that a good portion, I would say, I think 60 to 80% of them are volunteers. They are displaced nurses from other hospitals that no longer exist. Um, and they themselves are either living in tents, living with other family members in very close quarters, may not have access to a shower or bathroom themselves, and they rely on coming to the hospital to be able to take care of that. Their nursing skills, their nursing service that they offer to their patients may not be to the standard that you expect, but have patience, have understanding, and all you got to do, is just be there for them, help them out in whatever capacity. ICU nurses from the States are walking in with the understanding that, look, I can do this, this, and this to prevent infections. I can do this, this, and this to improve my patient outcome. Just do it. Just do it. And if they ask you questions, hey, why are you doing this? Then that's an opportunity, that's a window for you to educate, for you to build bonds. Um, you know, they just need help with the little things, and more importantly, they need someone to talk to. They appreciate. I'm non-Arab speaking. I made so many friends there because they are so appreciative of the fact that I came. I left my family. I left my safety. I left my home to go there and to help them when they feel like they are powerless and helpless and voiceless.
No, that is, I mean, you're making a very good point here. We always, when we do orientation, before you guys go to the medical missions, we tell our surgeons, our nurses, our physicians that, hey, you walk in there. This is a purely operational hospital in a collapsing health system run by physicians who might have lost a wife or a son or a father, and they are coming every day to work, and they are not being paid, and they are themselves have not took time off, 1 day off for the last 6 months. And when they leave the hospital, they go live in a tent, which might be cold or under the rain or sleeping on the mud. And they have children that they cannot assure them safety or ensure their needs, like food and warmth, and they are worried about them, but at the same time they're coming to work, working, and they are not having time to grieve the ones they lost, and they are not supported by, and they're still coming to work. So we're not the ones who are going to walk into the hospital, start being critical of standard of care. Just go with the flow. Go give them a shoulder, give them a hand, do what you can, like offload some of their duties and just make friends. They want us there for the human touch and the support, more necessarily than our skills. Not that they don't need the skills too, they do, and we offer it. We do a lot of surgeries there. We do a lot of good things, but I think they appreciate more that we are there for them, supporting them, telling them you're not alone. And just to speak to your point, I totally agree with it. And this is just to give set the stage for our future mission members about the atmosphere there.
The nurses walking in will never understand the mental status of the Palestinian individual right now. Just hear them vent, make them laugh, make some friends, be their support, be their shoulder. That is so important, so valuable to them.
Right. No, I totally agree. I'm sorry, did I cut you? Go ahead, Zahid.
No,
okay. Yeah, so my next question to you, like I always ask people about that, like what shocked you the most? Like in Gaza, going there, everything is shocking. I mean, from the minute you get into Gaza through Rafah in your car, going to the hospital, walking in the hospital, seeing people around, then seeing the injuries, then talking to people, hearing stories, walking in the hospital hallways, which are lined up by people living in the hallways, and then leaving Gaza and coming here and watching the news from a distance. So what shocked you the most about this whole thing? It doesn't have to be one thing. It can be more than one thing.
There isn't a one thing. There's a list. There's a list of things that have been shocking. For starters, like you mentioned, the first thing, like I have in my phone, I have some pictures and videos that I took for my own personal record. And we all got into the van at the Rafah border after we got our Palestinian stamp on our passports. We got on our van, everyone's smiling, and they open the gate. And as they open the gate, and now we start driving through, as soon as you open the gate, there's 1 million people just standing around. And the mood inside the van instantly changed. All the smiles disappeared, and everyone was just in shock and awe. That was just the first 3 minutes of leaving and starting to drive towards the hospital. Getting to the hospital, despite the conditions that we were walking in, we were greeted by some of the most resilient, amazing, smiling staff, family, children. The warmth that I felt was incomparable to anything I've ever felt in my life. We were assisted to where we were going to stay, and then in the evening we got to meet with the leadership of the hospital in a very formal environment, very formal meeting, but it was so well organized, so well oiled. I mean, the professionalism, despite the lack of resources throughout the whole country. And the one thing that I remember the CEO of the hospital saying, he's like, "Thank you guys for coming. Thank you guys for seeing us. We just want to be heard. We just want to be seen." And that was a huge impact. Huge impact. We didn't get a chance to do a walkthrough to the hospital until the very next morning, early in the morning. And our first morning there, we walked through the hospital, and as soon as you walk into the hospital, I mean, first of all, before you even get into the physical hospital, just the the area around it, the walking area around it, is all full of tents. Every square foot, every square inch is taken up by some sort of human residence at this point, temporary. Inside the hospital, people are living in hallways. They're living in stairwells, in closets, you name it, anything you could find. And I remember the first day, soon as we got to our ICU, I had to excuse myself. And I went to the bathroom, and I think I cried for 30 minutes because it was uncomparable to anything I've ever seen or witnessed.
Right. No, you're not alone into this, my friend. It is heartbreaking. And people look at those fellow humans in those tents. They tend not to know or forget or get just shocked and not to go into what's behind those tents, like stories. Those people, that might be a physician in that tent, might be a physician, might be a nurse, might be a teacher, might be an engineer, now living in a tent. And they had a house with a garden, with a big family and a car and a job, and now they're living in a tent, and they are just waiting for the world to give them justice and to stop this suffering, and they're asking for ceasefire, and people putting conditions. Well, we'll give you ceasefire if so and so. What that person in the tent, they are waiting for you to give them the ceasefire. That's the right. That just. But anyway, this is. I've known people before I met them, and I went to their houses, and they welcomed me, and now they are living in a tent. This is unimaginable. So, how about you? If you have American friends meeting with you and talking to you, and Gaza and this and that, and you want to tell them something they don't know, they might never know, or they will never hear on U.S. mainstream media, but you've been there and you have firsthand experience. You're gonna tell them, listen, guys, I've been to Gaza. Let me tell you this. What is it that you want to tell them?
Man, there are some of them. The Gazans, the Palestinians, are some of the most strongest people I've ever met in my life. A 12-year-old boy has more faith than a entire community here in the States, like men combined, adult men could not compare to a 12-year-old boy, because that 12-year-old boy going through the experiences that he's gone through at the age of 12, he's not a boy anymore. He's a boy by age, but he's a man. He's a man with much more experience than all the men here, including myself. I'm no better. I'm not. They have this unshakable faith in God. They have this unshakable faith in humanity. They understand that things happen with the will of God, but they also understand that as humans, we have a responsibility towards each other. They thanked. I don't know how. Okay, there's two things that I experienced there that I don't think I'll ever experience ever again in my life. Number one was on three separate occasions, the staff in the ICUs, they themselves have their own individual hardships. They're either living in compromised conditions, they're living in a tent, or they're living on the streets, or they're living in an unsafe environment, or whatever it may be. They've lost their family members, or whatever their situation is. On three separate events, the ICU staff had insisted, because this is how loving this community is, had insisted on preparing a meal for myself and some of the other ICU people. And when I say a meal, brother, I'm not talking about they didn't order pizza. I'm talking about they prepared stuff in the back room because now we're living in we're working and living in conditions that are not normal. So should you really be cooking in an ICU back room, in an empty back room? Probably not. But right now, it's their only means of survival in order to take care of themselves. That way they can take care of the patients. So they put together, and they wouldn't even allow us to pay. That was the part that killed me. I'm like, bro, you guys aren't even getting paid. How are you guys going to do this? They insisted. They collected what little funds they had, and they put together a meal. And I'm talking about the most delicious meal I've ever had. This one guy, he also insisted. He made this dish called
Mhm.
fatah hummus. Am I saying that right?
Yes, yes, fattat hummus, yes.
But brother, let me tell you, and he made it with this chicken. He's in a closet. He's in a supply closet. Okay. And I have pictures in my phone. You would think I was eating at someone's home the way he had prepared and presented it. And the love and the respect that I have gotten. I'm telling you, it was insane. It was absolutely insane. The second thing that I experienced, every single person that I made friends over there with is, again, living in very compromised situations. It's not ideal. And they have nothing. They have nothing for resources. They themselves are in need for everything humanly possible, everything from soap to Crocs to scrubs. I gave away my used scrubs, and I felt bad giving them away, and they took it so openly because they're like, bro, thank you, man, because I ran out of scrubs, or I can't go back and get my scrubs because my house doesn't exist anymore.
Mm.
So going back to what I was saying, the second thing was these people, though themselves have nothing, I somehow left Gaza with 1/3 of my suitcase full of gifts. How is that possible? How is that possible? That's because these people have a big heart.
Yes, they do. And I always tell people, whoever you are, whatever your background is, you go to Gaza, Muslim, non-Muslim, Arab, non-Arab, whoever you are, whatever color, nationality, race, religion, you go to Gaza, they will steal your heart. And all people who live Gaza want to go back again. And all people who went on medical missions, the first thing they say once they're back, when can I go back? I want to go back. And I cannot accommodate all people who want to go back, including yourself. You want to go back. Maggie want to go back. Rana, all the doctors, everybody want to go back. And I went to Gaza several times, and every time I go, I want to go back again. I mean, they steal your heart. They are people who are loving people, caring people. They love life, but they have dignity. They don't compromise. They want to live freely. So
Yeah.
and they're strong and they're resilient. And people might be asking, why like what is going on here? Like, doesn't make sense to them. Well, you need to know them so things make sense to you. But at the end of the day, they are humans. They are loving. They're caring. They have stories. They have families. They have children. They have a life. And you go there, they will shower you with their generosity, and they will teach. They will teach you life. They will teach you what it is to be a human being with dignity, and because people might think sometimes these guys love they let their children die. They don't mind dying. Well, no, they have strong faith. Who in the world, when their son or father dies, they just, you know how they go on the ground, like sujood, we call it in Arabic, which is a prayer to God. The first thing they do, they go down, put their head on the ground, and say, thank you, God. I have faith. This happened for a reason, and I'm not complaining. And they just stand up and keep going. Who has
Yep.
that level of faith? Who does have that? Nothing. People of Gaza teach the world life, faith, and resilience and dignity. I agree more with you, my friend, on that. They stole my heart too, and they stole your heart,
I
and that's
promise.
what they do.
So
Yeah.
just one last thing. And this is something that I have to mention. When I was leaving, like I said, you know, everyone knew that I was leaving, and you know, we exchanged phone numbers on WhatsApp and stuff like that. Um, they knew that we were taking the convoy from Rafah, from the hospital, to Cairo, and then from Cairo, I was going to return home on a flight. So many people texted me saying, "Hey, brother Zahid, did you get to your family safely? Did you catch your flight safely?" And I'm like, "I'm gonna be fine.
Yeah.
I'm fine, my guy. Like, you're checking on me? Like, like it doesn't make any sense. It boggles my mind how human they are, how dignified they are, how honorable they are, how generous they are. You know, it's just, yeah, it's insane.
Yeah, it is. So I want to ask you a question, and I ask everyone this when I get on like an interview like this, because you are healthcare workers from the US who went into Gaza hospital. You know, it's not unheard of that there are accusations that there are militants in hospitals, and that's why we go in hospitals. Like how that's how the case was made for a Shifa and all that. But I asked all healthcare professionals who get there. It's a straight question, and I put it on the record. Did you see any militants in the hospital hallways or around the hospital or anything like that?
Frankly speaking, sir, I think that is probably one of the most ridiculous accusations that foreign governments can have, including the US government. Because where on God's green earth are they going to hide? To answer your question directly, no, there are no militants. All there are homeless people. All there are people that don't have a future. All they have, all I saw was people that were injured. They were either physically, spiritually, emotionally, mentally injured human beings, people that have been stripped away from their humanity, stripped away from their freedoms, stripped away from the luxuries of life. They didn't have many luxuries to begin with. They were already living in a prison system, you know. But what they did is that they had made the best of their environment. But even that, in comparison to the United States and compared to any other free world, free country, is not free. They were still in prison, but they made the best of it. And even that was taken away, was stripped away. And all for what? For all these speculations that, hey, you know, there's militants there, there's a tunnel there, there's this.
I
Come
mean,
on.
I know it is outrageous to ask the question, but unfortunately, we are living in a world. These questions are being asked on CNN and MSNBC to medical professionals who've been to Gaza, and I'm concerned about the well-being and safety of medical mission members who are going to the European hospital. Because if Rafah got invaded, if there was a ground invasion to Rafah, guess what? European hospital is going to be a target. Like nothing
Yes.
special about it. Nasser in Khan Yunis, the same thing, and other hospitals. So I want people be saying, "Hey, I've been to this hospital. I've not seen militants in it. Now you are raiding it. You are raiding it. I don't know why." So, and I hope this will never happen. But look at the world and time we're living in, and that is my nightmare. That's the last standing hospital in Gaza, basically, and I hate for that to happen. So, my next question to you, my friend, is the last one. So, what should we do here to help our people in Gaza, like as U.S. citizens, other than going on medical missions and doing donations to charities and sending supplies? Like, what do Gaza people need the most? From all of us. I mean, the way I answer this, and you do it your way, I keep saying they need ceasefire. They need to stop the bleeding. They need to stop the offense. They need to take a break. They need to breathe. Ceasefire without conditions. That is what they need. And then everything else we are doing, like it's a band-aid on a big wound, like a medical mission for 2 weeks. So, but what can we do here in the US to help them? And what do you think they need the most?
What they need the most is not a ceasefire. What they need the most is to end the occupation. That's the truth. Only when we end this occupation, then can we actually have an open conversation about what needs to be done, and everything needs to be done from the grassroots. In the United States, we need to be able to have a open dialogue, an honest dialogue with the people that are criticizing what's happening in the Middle East and making these false accusations about Gaza, about the militants in the hospital and this, that, and the other thing. There needs to be a very open dialogue. There needs to be people who are taking accountability for the stuff that has already happened out there. The U.S. government officials need to be held accountable for ignoring the data, the facts. We, you know, the events that happened on October 7th, allegedly the numbers are 1,139 victims of October 7th. And since then, there has been a absolutely improportional or not proportional amount of victims at almost 40,000. That doesn't make any sense. With Israel being the way it is in terms of a military superpower in the world right now, they have abilities, they have resources, they have their own specialized forces to identify, isolate, and then remove the potential harm. Like find out if Hamas is there. I don't know where they are. If Hamas is there, they can find them. They can find them and just take them out. There's no reason to go around taking out 40,000 other innocent people and displacing almost 2.2 million other people.
And they also, I mean, the big catastrophe to the healthcare system, like we as medical charities, we focus too much on the healthcare system in Gaza, which basically, out of 36 hospitals, 30 hospitals were directly impacted by the war, and they are not operational anymore. And how do you expect people to get medical care? And also, the health system collapsed. So like nobody's taking care of the chronic illnesses, like dialysis patients, how they're doing dialysis, cancer patients, how are they getting chemotherapy, diabetics are not getting their medications, hypertensives are not getting their blood pressure checked, and they're not doing their routine labs. And this is not, I'm not talking about the communicable diseases and infectious diseases and the outbreaks and the public health disaster that is happening already. And on top of that, you are flooding hospitals with injuries and casualties and trauma, and depriving hospitals from resources and fuel and medical supplies and medical. I mean, it cannot be worse than this. It cannot be worse than this. And the people of Gaza are screaming, "Just help us!" And I think we need to speak up as much as we can. Talk to our congressmen and women, representatives. Just be the voice of Gaza people here. And I agree with you. Ceasefire is not enough. It might be the most immediate thing that is needed. But yeah, the oppression has to go away. Palestinians have to have their rights back, and justice has to be there for all, and equality for all. So there will be no reason for people to resist and things to get to where they are now. I totally agree with you. Yeah. Well, any final comment, my friend Zahid?
I would just say one final thing to whoever's listening, whoever's watching. The people of Gaza, all they want, all they need is to be heard right now. They need to be seen. They want to be seen. They want to be heard. They want to be recognized as humans, not just as prisoners or just as objects, inanimate, that doesn't have a willingness to live. They love life. They love human beings. They love people. They love each other. They love strangers. We need to mobilize. We need to get together, and we need to raise awareness and do what you can. Like Dr. Majdi just mentioned, we can do everything we can, starting from our homes. We can call, make the phone call, send the emails. It doesn't take long. Identify who your congressmen, who your political leaders are in your neighborhood, in your counties, in your states, and raise your voice. Attend the rallies, sign the petitions, send the emails, speak to people, speak to your neighbors. This is not a conversation that requires you to be taboo or requires for you to be scared. You're not saying anything wrong. You have
It's
the
your
freedom.
right. Yeah.
They need us. They need to be free. And it will change the outcome of the Palestinian people as well as all of humanity altogether.
Well, with that note, I will conclude our interview. And again, dear Zahir, thank you for your volunteerism. Thank you for being one of our mission members, going to Gaza and serving our people in Gaza and serving humanity. We can't thank you enough in PAMA and on behalf of the people of Gaza. Thank you, dear Zahid. Thank you.
The pleasure and the honor was all mine.
Thank you. Take care, huh?
Thank you.
Bye-bye.
Bye-bye.